other bones in the granule. One of them is ethmoid. Ethmoid has three parts. One is vertical plate. Transverse plate and lateral mass. It is ethmoidal bone from superior view. It is transverse plate or cribriform plate. Because the transverse plate has many foramens. This foramen is for passing the olfactory nerve. It is from superior view. Another is this from lateral view. It is from lateral view. It's lateral mass. Is vertical plate. The vertical plate cross the transverse plate and come to the cranium. It is named crista galli. A part of vertical plate is named crista galli in the cranium. It is lateral mass. This is lateral mass. In the lateral mass, we have the ethmoidal air cells. They are three groups: anterior ethmoidal air cells, middle ethmoidal air cells, and posterior ethmoidal air cells. They are three groups. These three groups opens in the malleus of the nose. The transverse plate is in the base of the cranium, in the anterior cranial fossa. You can see another shape. Here you can see the yellow color is transverse plate of it. The yellow is transverse plate of ethmoid. In the median part is crista galli. Here is crista galli, and in the lateral side, transverse plate or cribriform plate. Here it is in the ethmoidal notch of frontal. This from superior view in the base. Thus, the transverse plate of ethmoid is in the anterior cranial fossa, and it is in the roof of the nose. Here is roof of the nose and floor of the cranium. This is transverse plate or cribriform plate. What vertical plate in the septum of the nose? Here is. This yellow color is ethmoid. It is vertical plate. Many part of vertical plate is in the septum of the nose. But a part of come to cranium, it is named crista valley. Crista valley. Here is the septum of the nose. The vertical plate from posterior articulate with body of sphenoid, and in the anterior it is articulate with nasal septum, nasal cartilage septum. Here we don't have any cartilage. And in the inferior part, the vertical plate is articulate with vomer here. But lateral mass is like a cuboid. It has 6 surfaces. The lateral mass. You can see another shape here. In this shape, here you can see the medial wall of the orbit. From anterior to posterior, we have maxillary bone, lacrimal, and posterior to lacrimal, it is a part of lateral mass of ethmoid. Okay. It is named orbital plate. Here is see a part of this. We come back to the previous shape. You can see this is ethmoidal bone from the lateral side. It is lateral mass, and here is lateral surface. So it is named orbital plate. For the lateral mass, it is the lateral surface. But for the orbit, it is medial wall. The orbital plate of ethmoid is in the medial wall of the orbit. But another surface is medial surface of this lateral mass. The medial surface is named nasal surface because it is in the lateral wall of the nose. You know, if I have I draw here a schematic from sectional, from frontal section of the ethmoid. It is like this. It is like this. Like this. Its lateral mass, you can see here, is cribriform plate This is cribriform plate. It's frontal section. This is vertical plate. Here is crystal gully. Here is nose, nasal cavities. And here is orbit. Here is orbit. This lateral mass is medial wall of orbit. But this lateral mass is lateral wall of the nose. Here is nose. The vertical plate is in the septum of the nose. But the lateral mass is in the lateral wall of the nose. It has two processes here. One is small, another is very large. These are named concha. This is superior concha, inferior, and this is inferior concha. When we have concha, the mucous membrane of the nose go to many. Because this mucus is for warming the weather and for moistening the weather. Because this mucus has many secretions for moistening the weather in the respiration. Thus, why we have here concha? Because we want to have many mucus. Because all of mucus come here. If here we don't have any concha, if this medial surface was like lateral surface, flat, here we have less mucus. You understand? Yes. Do you have any question about ethmoidal bone?
Sorry. I think it is the small process of the ethmoid bone is the middle nasal canal.
Middle is large, but the small, the superior concha is very small.
So where is the middle canal?
What?
Where is the middle?
Where is the?
Middle nasal concha.
It is middle. Its middle is superior. But we have another concha in the nose. It is named inferior concha. It is another one.
You are right in the one in the board.
This is superior. This is, yes, you said. Thank you for your carefully. It is middle. It is right. Thank you for your attention. It is middle, no inferior. Middle concha. Thank you. Thank you. Mark? How no? You must go when you study for mark. I don't give any mark for your attention. You must attention. You said in the Arabic wazayif. One of your wazayif is carefully heard. It is middle concha in this shape. We have a process from orbital plate come to the nose. It is named uncinate process. This uncinate process will be in future articulate with inferior nasal concha. Inferior nasal concha. Here we don't have any inferior nasal concha and it is not articulate now. Thus, the uncinate process is a process from orbital plate of ethmoid that come to the nose and articulate with inferior nasal concha. Uncinate process. The crystal gully from superior, when we follow this from superior to inferior, it is one plate, but when come to inferior in the base of the cranium, it divides to Allah. It is named Allah crystal gully. Allah crystal gully. Or wing of crystal gully. Here is crystal gully, but in the inferior is wing of crystal gully. You can see here from superior view, it is crystal gully, but it is wing, two wings, one wing, another wing. Is Allah crystal gully or wing of crystal gully. Do you understand? Don't you have any question? Where is the list? Please give to anterior part. Here, these air cells are articulated with inferior border of the ethmoidal notch of the frontal. Here, articulate with frontal. You can see to another shape. In this shape. Here is, this is frontal bone from inferior. Here is ethmoidal notch. This is the border of ethmoidal notch. Here is articulate with lateral mass of the ethmoid. Here is 1/3 of air cell, and in the ethmoid is 2/3 of the air cells. Here we have two sulcus in the right and two sulcus in the left. It's anterior ethmoidal notch, it is posterior ethmoidal notch, anterior and posterior ethmoidal notch. In the superior part of lateral mass, we have like this notch, like this sulcus. And when they are articulated with each other, we have anterior ethmoidal canal and posterior ethmoidal canal. Anterior ethmoidal canal relate the orbit to the cranium. Posterior ethmoidal canal relate the orbit to the nasal cavities. From these canals pass anterior and posterior ethmoidal vessels and nerves. Do you have any question here? No? Is it ethmoidal bone very simple? You know, it is frontal bone. Here we have, I told you previous, here we have two sulcus in the right, two sulcus in the left. In the lateral mass of ethmoid, in the superior surface, we have like this sulcus. These sulcus are articulated with each other. When the ethmoid articulate here, we have two canals in the right, two canals in the left. Anterior ethmoidal canals, it is anterior, this posterior. Anterior and posterior. From this anterior and this posterior pass the nerves and vessels. The anterior ethmoidal is here. It is relate the cranium to the orbit, and in posterior relate the orbit to the nasal cavities. If you have any question, can You can ask me. No, I want to speak about parietal bone. It is a flat bone in the cranium. You can see this is in this shape. It is parietal bone. It has two surfaces. One is external, another is internal. In the external, we have a tuber. It is touchable in our cranium. It's named tuber parietal. And here we have two lines, superior temporal line and inferior temporal line. The parietal bone has four borders. Anterior border is articulate with frontal, is named frontal border. And here we have coronal suture. Posterior border is articulate with occipital, is named occipital margin or border, occipital border. And here we have a part of lumbar suture. Superior border is here, is articulate with another parietal, and here we have sagittal suture. It is named sagittal border. Inferior border is articulate with temporal squamous and don't have here any suture. We don't have here any suture. The parietal bone has four angles. It is anterosuperior angle, is articulate with frontal, is named frontal angle. It is anteroinferior angle, is articulate with sphenoid, greater wings of sphenoid. Is named sphenoidal angle. And here is pterion, that I told you before. And posterior superior angle is articulate with occipital, it is occipital angle, and posterior inferior angle, it is articulate with mastoid, is named mastoid angle. Thus the names of the angles are frontal angle, sphenoidal angle, occipital angle, and mastoid angle. Now we can see another shape that shows us the parietal separated from the cranium. You can see in another shape here, it is parietal bone from lateral view. It is external surface. This is like parietal bone. Here is anterior, here is posterior, from lateral line, right? Parietal. Here is tuber parietal. You can see here two lines. One line is here, is superior temporal line. One line is here, it is inferior temporal line. It is anterior border or frontal border, it is posterior border or occipital border, inferior border or squamosal border because it is articulate with squamous of the temporal. And it is sagittal border, that is articulate with another parietal for reforming the sagittal suture. This lateral surface, but it has medial surface. This medial or internal surface. In the internal surface, we have many sulcuses. These are for branches of middle meningeal artery. It is the largest artery that comes to the meninge. Meninge is a membrane that has 3 layers and weird over the brain and the spinal cord. Thus, they are named arterial sulcus. In the practical exams, we point here. You must write in your sheet arterial sulcus. But a student wrote right here parietal bone. Don't have anyone. If we go to the street and show this bone to a person that walking in the street, what's the name of it? Said parietal. But medical student must know this bone very carefully. Another in the medial internal surface, in the posterior, inferior, in the mastoid angle from medial side, we have a short sulcus. It is for sigmoid sinus. Its name sulcus for sigmoid sinus. From here, the sigmoid sinus beginning, and then go to the temporal bone and go to the occipital. I told in the last week. Another thing in the internal surface is this sulcus. Here is better seen. This is for superior sagittal sinus. But here we have two parietal bones come articulate with each other, and in the external we have sagittal suture. Beneath the sagittal suture we have sagittal sinus. And you know the sagittal sinus is only one sinus. When impression in these two bones, when we separate two bones, semisulcus is here, another semisulcus in another parietal. Thus, here names semisulcus for superior sagittal sinus. Semi in Arabic means nisf. How about nisf? How about nisf? Another, you can see from the external and internal a foramen. Many, one or two foramen. This named parietal foramen. It may be in person we have, maybe to another person we don't have this foramen. Foramen parietale. It is for passing of emissary veins. I told you ago that emissary veins are the veins that they are in the external of the cranium and come to the internal of cranium. These are named emissary veins. Thus, in the internal surface, I told you arterial sulcus. These are four branches of middle meningeal artery. Sulcus for sigmoid sinus, semisulcus for superior occipital, superior sagittal sinus, and foramen parietal. Do you have any question? Here is frontal angle, sphenoidal angle, mastoid angle, and occipital angle. But in the margin, anterior margin or frontal margin, posterior margin or occipital margin, inferior margin or squamosal margin, and superior margin or sagittal margin. If you have any question, please ask me. I told you this sentence many times. This time is for asking me from you questions. But if you don't ask me any question now, I will ask you in future in exams many questions. This time is for the time that you must examine me. You can examine me. No. Please set your question. I said what's the yes, your question. No, we speak about frontal, parietal, occipital, ethmoidal. These are 4 bones. But I want to speak now about sphenoidal bone. Do you agree?
No.
Why?
So difficult.
It's a good bone for asking you.
The next.
We can set for you, we can ask you many questions in the sphenoidal. I told you from the 22 bones in the cranium, only 3 of them is difficult. One is temporal, second is sphenoid, third is ethmoid. Another is very simple. Another bones are very simple.
مصروف 21 هذا يمكن 22.
The sphenoidal bone is the one of the important bones in the cranium. It is articulated with many bones. The sphenoid are participate in the orbital cavity, nasal cavities, temporal fossa, infratemporal fossa, pterygopalatine fossa, and is participate in all of 3 cranial fossa. It's very important bone. Here is the green color. Here is anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. You know the sphenoid here is in the anterior cranial fossa, here is in the middle cranial fossa, and a part of this here is in the posterior cranial fossa. No bones in the cranium participate in 3. Only a sphenoid does this position. I will give you a rest until this one is. Second is greater wings, and third is lesser wings, and fourth is trigoid process. Do you know what's the meaning of trigoid? Here is right PT. P is not pronounced. Must say trigoid, no petrigoid. Petrigoid is right. You must say trigoid. Is aba, foot. Foot is trigoid. In the Arabic you say arjuluhu, rijl. Because this is like the, you know, sphenoid is khuffash. is the foot of the hogwash. Here is body of sphenoid. Here is lesser wings. It is 2. And here is greater wings. It is 2. Here is body. You know, the sphenoid is the one of the bones that have sinus. The sinus is in the body. But from this view, this is internal view, from superior view, you cannot see pterygoid process. Why? Because pterygoid process is from external view. You can see from external and inferior view of the base. I will show you another shape here. It is from inferior view of this red is sphenoid. This is pterygoid process. They are 2. It one. This is greater wings. Where is lesser wing? We cannot see from this view. Yes. I told you, sphenoid is participating in many fossa and spaces. They are orbit, nasal cavities, temporal fossa, infra temporal fossa, palatin fossa, and I told you it is in the 3 cranial fossa, anterior, middle and posterior cranial fossa. You can see the sphenoid, another shape here. This is anterior view of sphenoidal bone. This is body, and this is greater wings, and this is lesser wings, and this is pterygoid process. This is from anterior view. Another shape is from posterior view. This is body, a part of body. This is pterygoid process. This is greater wings, and these are lesser wings. Do you understand what is the 4 parts of the sphenoid? No, I want to speak. For beginning, the body. The body is like a cuboid. In the body, we have a space. This is sinus of sphenoid. But this body has 6 surfaces: superior, inferior, anterior, posterior, and 2 lateral surfaces. There are 6 surfaces. The superior surfaces is in the base of the cranium from internal. We come back to previous shape, figure, previous figure. This is the figure. Here is the body, superior surface of the body. From anterior to the posterior, we have many points here. One is this. It is articulated with ethmoid, is named ethmoidal spine. Posterior to it, we have a flat surface. It is named jugum. Here is jugum. Posterior to jugum, we have a transverse sulcus. It is named chiasmatic sulcus. because from this canal come to the cranium, optic nerve come here and chiasmatic here. This is sulcus for chiasmaticus or chiasmatic sulcus. In the posteriorly, we have here a small tubercle. It is tuberculum cellae. You must know cell. Cell is like this, or saddle. Do you know what's saddle? Saddle? What's the meaning of saddle?
Surge.
What?
Surge.
Search? In the Arabic search?
It's the letter of the horse.
In the Persian we said zin. For horse. What's in Arabic? Zin. Search. Search. Is with like this. Like this.
Yes.
Sella is search in the Arabic. Because in the here we have a fossa. In this fossa we have hypophysis gland. This fossa is like search. In the Turkish or Osmani government. Here is named Turkey. This is named Sella Turcica. This fossa is named Sella Turcica. And here is the dorsum cella for اتكاء.
Is it for glands?
Quran said متكئين متكئين على رفرف خضر وعبقري ساعة.
Is it for glands articulation? Sella turcica.
Yes, no. Here is for hypophysis, but the posterior surface of body is for articulation. The posterior surface of the body.
For the
No
pituitary
cellular.
gland.
No cellular. Here is dorsum cella. Here is sella turcica. But the hypophyseal gland is very small. The hypophyseal gland is in the floor of here. The floor of this sella turcica is named hypophyseal fossa. This means the hypophyseal fossa is a part of sella turcica. This space, not all of here is the hypophysis. Hypophysis is very small. Hypophysis in the floor is seated in the floor. Hypophysis, floor of sella turcica. That the floor of sella turcica, that is fossa, that is deep, is named fossa hypophyseal. Do you have any question? And here is dorsal cella. Thus, in the superior surface of the body of the sphenoid, we have, I repeat, we have ethmoidal process or ethmoidal spine, jugon, sulcus chiasmaticus, tuberculum cellae, sella turcica, dorsum cellae. Dorsum cellae for اتكاء. In the search. Do you understand? No? We have clinoid process. Do you know what is clinoid process? You know, in the many years ago, you said in Arabic, in English said king. What's in Arabic king? Malik. Malik come to sit over the, what's in the Arabic takht? No, says takht. Takht padishahi. Takht Malik. Arsh. The Malik in many years ago sit on the arsh, and this arsh has a handle for going to up. In the Latin, the arsh is clinoid. Arsh is clinoid. Here we have three pair of clinoid process. The handle of the arsh is like clinoid process. This is anterior clinoid process. This is for lesser wings. Here is middle clinoid process. And in the dorsum sella, it is posterior clinoid process. I repeat, posterior clinoid process are two, middle is two, middle clinoid process, and here is a part of lesser wing. Here and here is anterior clinoid process. Do you understand? What's the meaning of clinoid? Arch. How about arch? The process of the arch. Clinoid process. Do you understand? What's the time? 9 and? Only 9? This is 9. 1 minute to 9. You can go for eating breakfast or of the body of sphenoid. I told you it has 6 surfaces. One is superior, I discussed about this. Another is lateral surfaces. They are 2 lateral surfaces. The lateral surface is for touching the wings. Like this daughter that come now to the class in the terminal of term, maybe take the exams, the mark is very less. Come to me and said me, please give me, it's very bad. It's very bad. You can see here, it is lateral surfaces. When the lesser wing come to touch the lateral surface of the body, divide 2 parts. And between 2 parts, we have here optic canal. Here is optic canal. The optic canal is between the attachment of the lesser wing to the body. From this canal has 1 optic nerve, 2nd ophthalmic artery. Do you know what's the meaning of ophthalm? Eyeball. Eyeball is ophthalmic. This means ophthalmic artery come to the eyeball and the muscles of the eyeball. This artery is a branch of internal carotid artery from the internal of the cranium. For arriving to the eyeball must pass from optic canal. The ophthalmic artery beginning in the cranium here, beginning here, and then pass from optic canal to the orbit and come to eyeball and the muscles. Another is here. When the greater wings come to the body, here we have a sulcus. This is named carotid sulcus. Why? Because from here, the internal carotid artery passed from here. In the carotid sulcus or carotid groove, do you know where is the carotid groove? It's here. It's here. Is a sulcus in the right and left. This is named carotid sulcus. In the carotid sulcus, we have two components. One is internal carotid artery, another is cavernous sinus. It is one of the sinuses from the dura mater in the cranium. Cavernous in Arabic said calf. Calf. Do you know what's calf? In the exam, we ask you clinical points like this. If a person has a fracture in the sulcus carotid, which component is injured?
What was the question?
Repeat the question. Repeat. When in a traumatic person fracture the sulcus caroticus or the lateral surface of the body of the sphenoid, which component is injured? This carotid is injured. Internal jugular vein, cavernous sinus, optic nerve, and another thing. Here the what's the correct?
Optic nerve?
No, optic nerve goes from here, no here. It is cavernous sinus. Or in the choice, maybe we have internal carotid artery. These two are. You understand? No? Another surface is anterior surface, inferior surface, and posterior surface. You can see to another shape, to go another shape. Here is, this is anterior surface of the body, anterior surface of the body. Here we have a crest that is articulate with vertical plate of ethmoid and two foramens. This foramen is for sinus of the sphenoid. This foramen open to the nose. Another bony part is here, is concave sphenoid. This is concave and this is concave. You can see here, the sphenoidal concave is here. Thus, in the anterior surface, we have anterior sphenoidal crest, articulate with vertical plate of ethmoid, and foramen of the sphenoidal sinus that open to the nose, and concave. Maybe ask you, in a person, anterior surface of the sphenoid is fractured. Which components is injured?
Anterior.
Anterior surface, which components injured? In the multiple choice. Maybe concave. Concave is the wood, the carrot. Or set thyroid process, or another things. But here we have inferior surface. Here is articulate with vomer. Allah vomeris come articulate here. Another surface is posterior surface. You can see another shape here. It is posterior surface. It is not soft. It has many process here. Here is articulate with basilar part of occiput, and its name is sphenobasilar joint. That this is posterior surface. But here is dorsum cellae. Here is posterior crinoid process. You can see right here, posterior crinoid process. Maybe said if the dorsum cellae is fractured, which crinoid process is injured? Posterior crinoid process. Do you understand? If you have any question about the body of a sphenoid, please ask me.
Now ask a question. Can you repeat this question?
What?
The last question you are asking now. Can you repeat it?
The lesser wing has two surfaces. It is one surface, it is superior surface, and it is named cerebral surface because it is contact with the brain. And this is a part of anterior cranial fossa. The anterior border of lesser wing is articulated with orbital plate of frontal. But the posterior border is free, not articulated with any bone. Thus, the lesser wing has two surfaces and has two borders. One border is anterior border articulated with orbital plate of frontal. Another border is posterior border, not articulated with any bones, is free. One of surface is superior surface that you can see from here. This is named superior surface or cerebral surface because it is contact with the brain. Another surface that you can see to another figure is inferior surface. That is roof of the orbit. Is said orbital surface. Thus, the lesser wing has two surfaces, superior surface or cerebral surface, inferior surface or orbital surface. This is one of the part of the roof of the orbit. Now, I want to speak about greater wing. It is very carefully must you intention here. This is greater wings. It has two surfaces, internal surface and external surface, and two borders, anterior border and posterior border. Anterior border, a part of anterior border is articulated with frontal, but another part of anterior border with the lesser wings, between them we have supraorbital fissure. Supraorbital fissure means a deep fissure, deep sulcus. This fissure is between the orbit and middle cranial fossa. It is very important. This fissure is between lesser wing and greater wings. It relates the middle cranial fossa to the orbit. From the supraorbital fissure has many nerves and vessels that are very important. They are, in the cranium from the brain, we have 12 pair of the nerves. Do you know? 12 pairs of the nerves. 12. From this fissure, pair of 3, pair of 4, pair of 6. There are 3 pairs of the cranial nerves passed from here. These 3 nerves come to the orbit for innervation of the muscles of the eyeball. The name of 3 is oculomotor nerve, 4th is trochlear nerve, 6th is abducent nerve. These 3 pass from supraorbital fissure. Another nerve that pass from the fissure is ophthalmic nerve. It is one of the branch of trigeminal nerve. It is a sensory nerve. When pass from fissure, come to orbit. It is for sensory of the orbit. You said my eyeball has pain, or sensory of the temperature, or sensory of pressure. When a thing goes to your eye, you said a thing come to eye. This is sensory for ophthalmic nerve. The trigeminal nerve, it is 5th nerve of the cranium. Has 3 branches. Do you know what's the branches of trigeminal? Ophthalmic. All of fibers is sensory. Maxillary. All of fibers is sensory. And mandibular. Many fibers of mandibular is sensory. But a small fibers is motor. Only mandibular. I must tell you the ophthalmic nerve has 3 branches. The ophthalmic nerve has 3 branches. One is frontal nerve. It is very large. Second is nasociliary, and third is lacrimal nerve. These 3 is from ophthalmic. I repeat. One is frontal, second is nasociliary, and third is lacrimal. These 3 are sensory. Now I tell you the frontal nerve that is very large has 3 branches. Medial supraorbital nerve, lateral supraorbital nerve, and supratrochlear nerve. These 3 come to the skin of the forehead here for sensory. These 3 pass from supraorbital foramen in the frontal. Thus, now you learn the names of 9 nerves. 9 nerves. What's the 9 nerves? These 3 daughters are from my intention absent, no present. You come back to the class very late. I told you rest is only a quarter. What's your name, mister? Your name? Sajjad? Sajjad is very good student. Go to exist, go to out, and eating very good, very fast. And come back on time. When I'm coming in the class, come with me to the class. And many of daughters, many of boys come on time. But some of them come late. Please, man, give you a rest for better learning. You must come back on time, no late. If you come late, this means you are absent. You understand? No, I told you here we have 9 nerves. You learn now. What's the 9? What's the 9? Trigeminal has 3 branches. maxillary, mandibular, ophthalmic. Ophthalmic has three branches: nasociliary, lacrimal, and frontal. Frontal is largest. Frontal has three branches: supraorbital, medial supraorbital, lateral supraorbital nerve, and supratrochlear. These are 9. 3, 3, 3. 3, 3 is 9. This means 3, 3 is 9. 9. Thus, here is very important. Do we have another components that pass from here? Yes. Ophthalmic vein. The venous blood of the eyeball come back to the cranium by passing from this tissue. Ophthalmic veins. Thus, here is very important. What's the time?
9:45.
It is a quarter to 10. Yes? I only 5 minutes said you because you must have rest for the class that beginning for in the 10. The greater wings when come to the body has 3 foramen. You can see here 1, 2, 3. From anterior to posterior, the names of these foramen are foramen rotundum, foramen oval, foramen spinosum. Why the name is spinosum? Because here is a spine. Here said a spine of sphenoid. No spine of greater wings. Because if you set a spine of greater wings, this means lesser wing has a spine. But lesser wing don't have any spine. Thus the name of this spine is sphenoidal spine. Spine, in the Arabic you said shock. It is foramen in the shock. The name is shock, nafaq. Surah is nafaq, surah in Arabic. Foramen in Arabic. Nafaq, foramen in Arabic. Nafaq. What she said? Nafaq? No. Naqab. That's the naqab. Is the shock naqab. You understand? It is foramen rotundum. Rotundum, you said in Arabic, dire. Foramen rotundum. It is foramen oval. In Arabic, basic. Basic. This is diagonal and this is base. This foramen is like base. The oval. Oval is base. From this foramen rotundum, past the maxillary nerve. From oval, past the mandibular nerve. And from spinosum, past the middle meningeal artery. It is the largest artery for meninge. Meninge is a membrane that over the brain and the spinal cord. Weird over the brain and spinal cord. This artery comes from external of cranium to the internal of cranium. For coming to the internal of the cranium, must this artery pass from this foramen. This artery is a branch of maxillary artery, middle meningeal artery. when this artery branches, the parietal one I told today, the sulcus of the arterial. This is 4 branches of this artery. Middle meningeal artery. It is the largest artery for blooding of the meninge. It's very important artery. In head injury, this artery may be torn, may be injury. And we have many blood in the cranium, and this blood go to hemorrhage, to go to clot, and then pressure the brain, and the person go to coma. You understand? This artery in head injury is very important. This artery that pass from spinozoom foramen. Another surface is external surface. I will speak about external surface and pterygoid process in the next week. And after we speak about temporal bone. Please, before coming to the next class, study. Which both study, sphenoid must be studied and temporal must be studied before coming to class. You must remember in your mind that